May is Mental Health Awareness Month. You realize how important this month is this year. There are more kids than ever who are suffering from a variety of mental illnesses and who need care. Many of them aren't able to get the care that they need because of the shortages of therapists and other clinicians. So it's critically important that this month that you do your part to increase awareness of what's happening with children's mental health. Our work is about hope, and we retain that hope and sustain that hope even in the face of almost 1,000 children waiting for the valuable mental health services that we provide. And we sustain that hope because we know that every kid we serve, it makes a difference. As we support children and families in navigating this ongoing mental health crisis, we are very focused in three areas. The first area is expanding therapeutic services. With the demand that's out there, we need to deliver more of the services we're already delivering and also be innovative in coming up with new services to meet the sustained levels of demand that are out there in the community. The second is around our workforce. We cannot do what we do without our incredibly talented and compassionate staff. And we need to make sure that as they're dealing with supporting the community with a higher intensity of demand and a higher intensity of severity and complexity of cases, that we're supporting them and taking their care of themselves so that they can be there to take care of the kids and families in our community. And finally, we need to do all of that in a way that's financially sustainable for us. And there's challenges with that because a large portion of our revenue comes from reimbursements from commercial carriers and from the government. And one of the areas we focus on is really our advocacy work around making sure that the government and the state legislator is aware of the fact that we need higher reimbursement rates around medical assistance so that we can continue to invest in our staff and pay our staff in a competitive way and invest in their development. Washburn is over 140 years old, and we could not have made it to this point without the support of donors like you. Your support makes a difference in terms of our ability to see even more and more children and support more and more families and even add capacity to our staff to take care of more kids. And we are just so grateful for your continued support. And as we face this time of unprecedented demand, I hope that you'll consider increasing your gift. With the severity and complexity of cases, with the challenges we're facing around the workforce, your increased gift can have an even bigger impact than perhaps it has at any other point in our history.